We really are at a crossroads. And what we believe and what we share with others is making a difference in the global discourse. Yes, we're speaking about COVID-19 still, and what's come front and center into the dialogue are the COVID-19 vaccinations. I'm really an advocate of everyone making an individual decision on this topic, but I've got to tell you something. As a physician and public health professional, I am getting more and more concerned at the barrage of information that even people who I know personally are sending me. Just today and yesterday, again, more links to things that are filled with, well, maybe good intentions, but a whole lot of misinformation. There's a lot of myths circulating out there. And if you're like most people, you've already figured this out. You don't need to watch this video. Well, I'd ask you to think again. Please hear me out, because there's a very good chance from what I'm seeing that you've bought in to some of the 5 leading myths that are circulating about COVID-19 messenger RNA vaccines. That's right, because right now we're at a very difficult juncture. No question about it. If I were to be honest, and I will be in this presentation, I've been right there with a lot of you. I'm someone who spent the majority of my life getting patients off of medications, helping them to embrace natural strategies to lower their blood pressure, address their diabetes, prevent other chronic illnesses, or even reverse diseases, autoimmune conditions, you name it. So how does that all fit in when we're starting to talk about a vaccination? Well, I'll just be honest with you. Just from the beginning of this presentation, I was not all gung-ho for these COVID-19 vaccinations when I first started hearing about them. In fact, like a lot of you, I was pretty skittish myself. But I've been looking at the data, and I've got to tell you that although this was not a slam dunk case for me by any means, I think there's a lot of things that are transpiring that we need to look seriously at, because there's myths circulating, and they're myths that I believe that could have serious and even life-threatening consequences. I'm going to look in this video at 5 COVID vaccine myths. The first one is that these vaccines are unnecessary. COVID-19, it's really not causing any increase in mortality. It's not something we should be worrying about. Number 2 myth that we'll look at, the messenger RNA vaccines are not effective. Myth number 3 is that people are dying in large numbers from these vaccinations, or just make it even simpler, these messenger RNA COVID-19 vaccines are dangerous. Number 4, these vaccines are experimental. And myth number 5, the Tuskegee experiment proves that we can't trust messenger RNA vaccines. Now, let me tell you, this is a video to answer your personal questions. In this video, I am not going to be talking about public health concerns. You see that bottom bullet point. It's not a video about the public health benefits of messenger RNA COVID vaccinations. And I think this is a very important topic, but I'm not going to be dealing with it, at least not to any extent in this particular video, maybe a future video. This video actually was designed to answer your questions. People have been reaching out to me. They've been asking me things, both my patients and individuals who listen to my weekly radio show, who have watched my videos. And my job in this video is not to try to persuade you to get the vaccine. I will just be honest with you. Like I said, this was not an easy decision for me personally, whether I should get the COVID-19 vaccination or not. And I'm saying the vaccination, of course, there's several vaccines that are options right now in the United States. But I was one of those people that struggled with it. I was not airing my concerns publicly, but speaking with other colleagues, other individuals. And I'll just tell you at the beginning of this video that I will let you know whether I've decided to get the vaccine, whether I've actually done so before we finish. But let me share this with you. Motivation of this video is not to persuade you to get vaccinated, but this is my big concern, and this is why, if nothing else, I'm doing this video today. And that is, I believe the majority of people in America who have not been vaccinated, I believe the majority would be vaccinated and would benefit from the vaccine if they had access to truly balanced information. And that's what I'm going to look at with you here, because I find many people telling me, oh, I'm not getting the vaccine because of X, Y, or Z. And many of the reasons they're giving me are simply based on myth. Let's dispel those myths as we go through the presentation. Now, some of you are already asking, why am I focusing on the COVID-19 messenger RNA vaccines? The reasons for it are pretty simple, really. There's a lot of controversy about the vaccinations. I'm trying to make this as simple as possible, and we're looking at the vaccines that have the longest track record of use in the United States. We're talking about two vaccines, one made by Pfizer, the other made by Moderna, that have no use of fetal parts in the vaccine or in the testing of the vaccine. I know that's important to many of you. That's not an issue with these messenger RNA vaccines. Also, these vaccines are typically distributed in multi-dose vials. That means there's no way someone can put a tracking device or tracking devices into those multi-dose vials and be dispensed to specific individuals. And finally, perhaps most importantly, as far as making the dialogue as simple as possible, there never was a pause, an official break, if you will, to say, let's re-examine this, as was done with the Johnson & Johnson vaccine. Nothing against the J&J vaccine. That's not where I'm going with this. And again, I'm saying nothing against it, not in this video. I'm just not looking at it. So we're trying to focus on the messenger RNA vaccines, the Moderna vaccine and the Pfizer vaccine, released in conjunction with BioNTech. So with that background, if you feel like I've just hastened through some things pretty quickly as to why I'm emphasizing the mRNA vaccines, feel free to check out my video, Plain Talk About mRNA Vaccines, that was released recently. So let's look at these myths now. Myth number one, these vaccines are simply unnecessary. People have allegedly died from COVID-19, but US death rates are unchanged. Have you heard that one? I've heard it from multiple sources. They say, hey, Dr. DeRose, yeah, people, they say, are dying from COVID-19, but I've heard death rates haven't changed. Well, that is simply not true. This is data from April 2021, looking at what happened in 2020 in the United States. This is data just recently published. And what I want you to notice is if you look back at 2019, look back at 2019, and you'll see that here in the United States, some 715 people were dying per 100,000. If you look, though, at 2020, 828 deaths per 100,000 in the population. That's an incredible 16% increase in the risk of dying from something, okay? Now, the data suggests that increase in mortality risk is from COVID-19. But let me just go along with the naysayers. They're saying things like, oh, well, my grandfather died. He fell down the stairs and they said he died from COVID-19. I'm not going to tell you there's absolutely no misclassification. There's always some things when you're categorizing things, classifying things, filling out death certificates. I've had to fill them out as a physician. Yes, things can be misclassified. But the point I want to make, no one is arguing. I've not heard anyone arguing with the fact that deaths are up 16% in a year. This is incredible. And really, the only explanation for it is COVID-19. So whether you think, some state wasn't keeping track correctly, or whether some individual, some doctor said in our hospital they weren't tracking the COVID-19s, right? They were putting COVID-19 for things that weren't COVID-19. Do you understand the problem? The deaths were still up 16% in our country. These weren't people that hadn't died. So some people can quibble about what they were dying from, but something cataclysmic, something dramatic happened in 2020 in the United States, and nothing else fits the bill except for COVID-19. But it's worse than that as far as making this more contemporary. This is data now. We fast forward to April of 2021. And what we're seeing is something very interesting happening as we're looking at the data on individuals who have been hospitalized with COVID-19 infection. So now we're looking at serious infection. Many people have been telling me, oh, well, this isn't really of worry to me. I'm at low risk. I don't need to be concerned. I'm young. How young is young? It's true. At the height of the pandemic, this is a blow up of that previous graphic. The height of the pandemic, as far as mortality, hospitalizations here in the United States, December 2020 to January of 2021. When you look at that data, you see something striking, and that is the population group that was the hardest hit was those over 65. Often the majority of people in the hospital in December and January, through January of 2021, they were individuals in that 65 plus age range. But what's changed dramatically in just 4 short months is now we're seeing the majority of patients that are being hospitalized are under 65. And you can see in the graphic roughly equal numbers of people who are under 49 as opposed to those who are between 50 and 64. So this is, yes, hospitalization rates down, case rates down. But when you're looking at who's being affected, there is a disproportionate number of younger people now being affected. And this is really telling us that we all really need to be concerned still about COVID-19. So the messages are simple. COVID-19 continues to infect, hospitalize, and kill people. But a growing percentage of those who are having the most severe complications are younger individuals. In many cases, under 65, in many cases, under 50. And lack of immunity seems to be what's driving the increased relative hospitalization rates in younger individuals. In other words, older individuals have done better with getting these mRNA vaccines, and younger individuals have not felt it was as important. This is an important issue. Let's go to myth number 2 now. Myth number 2 is simply that the messenger RNA vaccines are not effective. What does the data actually show? Well, let me first go to some of the naysayers. Believe me, I've had multiple people send me stuff highlighting this same story about Argentina's president testing positive despite having received the coronavirus vaccine. Now, there's many possible explanations for this, but let's give the naysayers the benefit of the doubt. Let's say the Argentinian president got one of these messenger RNA vaccines. He got the first dose. He got the second dose. No exposure to COVID-19 during that whole time, okay? A whole month out. He's got optimal immunity from the vaccine, and now he's exposed, and now he gets the infection. Now, I'm not saying that happened, but that's the worst case scenario, if you will, for the vaccine's efficacy. So even if that happened, let's look at this statement. I've actually heard this, by the way, this very statement, multiple people have sent to me. The vaccination, speaking of COVID-19, vaccination in general, does not stop you from getting the virus or spreading the virus. And then they cite this example. Was that proof of it? Wait a minute. Who's saying that the vaccine stops 100% everyone from getting the virus or spreading the virus? No one's ever said this. This is that typical straw man argument saying, hey, I just have to show you one case where someone got the vaccine, got sick. It means the vaccine's no good. I mean, can you see that? I'm not saying that that's why people sent me this or that's why people are using this argument, but I'm just saying this is not what anyone's saying. No one's saying it's 100% effective. But the implications of this statement, the vaccination does not stop you from getting the virus or spreading the virus, that is implying, if you take it very literally, that the vaccine is worthless. Is that what the data shows? That is a total myth. These vaccines have documented effectiveness. Multiple studies, multiple countries, typically in the range of 80 to 90% or better, showing that they prevent infection, they prevent symptomatic disease, they prevent hospitalizations, they prevent deaths. That's what the data is showing. Have it projected there for you. It's more than that, though. Because one of the real questions is this helping me to not spread the virus? And I know we're getting into the public health, but this is not the main emphasis here, but I know individuals for their own sake are concerned. Am I going to put other people at risk? Asymptomatic infections dramatically decreased by these vaccines in the range of 80, 90% or better. And these are the most risky scenarios as far as transmission. After all, if you're feeling sick, I mean, common sense today, if you got a fever, you can't smell or taste, you're supposed to be staying home. And you have COVID-19 infection until proven otherwise. But it's the asymptomatic individuals or pre-symptomatic, before they've developed symptoms that are at the highest risk of transmitting the virus. These vaccines help to prevent that. And when you actually look at households, unvaccinated people in their household have been vaccinated, they are less likely to catch the virus. Myth number 3. People are dying in droves from messenger RNA COVID vaccinations. I will just be honest with you. I'm very concerned with this kind of rhetoric. People talking about how dangerous these vaccinations are. Now, some of these people may have good motives, okay? Their motivations may be good. And I'm not questioning people, whether they're altruistic or not, whether they're sincerely interested in their fellow man. But here's the deal. The way most of these things are being worded and phrased, and many of these videos that are going out there, many that you've watched and you've asked me to watch them, from my vantage point, these are nothing but scare tactics. Extremely powerful anti-vaccine rhetoric without true transparency. Now, I don't know what people's motives are. And again, I'm not in a position to question them. But I hear statements like this. And by the way, I've gotten multiple people sending me videos saying things like this. We aren't, again, I'm paraphrasing. We're just trying to get the information out there. We want people to make intelligent decisions. And then they start spewing out all these myths, all these half-truths. And I'll be honest with you, even as a professional, I watch this stuff and I say, wow, I'd never get that vaccine. This is scary. This is really bad stuff. Well, is it true? Is it really that dangerous? Let me tell you, one of the sources that, again, I've gotten multiple people reaching out to me, asking me about this. Health Impact News sounds like a reputable health organization. It's not a health organization. Okay, you go ahead and check it out. These are people with a religious agenda. Now, in their defense, some of their religious presuppositions I would embrace, I would agree with from what I've seen. Some of them I'm very worried about. And it's not a religious argument. If you have religious reasons not to get a vaccine, well, that's fine. Don't get the vaccine, okay? But don't try to twist other people's arms by misusing the vaccine information. And that's what myth number 3 is. People dying in droves from COVID-19. Here's what they're saying. This is their website, Health Impact News. At one point, 4,500 people dead. How did they come up with this? They got data from something called Vigilance. It's a European database of suspected adverse drug reaction reports. We have something very similar in the United States called VAERS. What's shocking to me is that it seems like people don't understand what vaccine adverse event reporting is. If people are honest, and if you're using that data, why don't you just use the very first thing that shows up when you go to Vigilance? I didn't have to search for this. This is what comes up right when you go to the website. Key information, bullet point number 1. The information on this website relates to suspected side effects. In other words, medical events that have been observed following the use of a medicine, but which are not necessarily related to or caused by the medicine. But they don't stop there. Look at the next bullet point. Information on suspected side effects should not be interpreted as meaning that the medicine or the active substance causes the observed effect or is unsafe to use. Only a detailed evaluation and scientific assessment of all the available data allows for robust conclusions to be drawn on the benefits and risks of a medication, or in this case, a vaccine. What is the point here? The point here is that you can't go to a vaccine adverse event reporting system, tally up the number of people who died in the time surrounding the vaccine, and say that this is due to the vaccine. Now, some of you may be scratching your heads because I find a lot of people don't understand how these systems work. So let me explain. Let me make it very practical. Let's look at data from before the COVID-19 epidemic. Let's go back to 2018 and look at data from the United States. What I want you to notice here is just what you'd expect. If you look at people in the 15 to 24-year age range, they have lower death rates than all age groups older than them, okay? You can see the death rate goes about doubles as you get into your 20s and into your early 30s, mid-20s to early 30s, and it continues to accelerate from there. By the time you look at Americans 85 and older, you'll see that over 13,000 out of every 100,000 individuals in that age group will die each year. Expressed another way, we're more used to percentages, most of us in lay circles. So over 13% of the population of Americans who are 85 and over will die each year. Now, that may not sound all that shocking. We don't expect people to live a huge amount of time longer after they've had their 85th birthday. You say, well, what does this mean then as far as vaccine adverse event reporting? Well, let's take a hypothetical situation. Take an individual who is 86. Okay. This individual, 86 years of age, we're going to follow him or her for the course of 2 months. Why 2 months? They're going to get one of the mRNA vaccines. They're going to get the first dose, let's say right now. We're going to follow them for 1 month after that first dose. Then they're going to get their second dose, and we're going to follow them for another month after that second dose. Okay, just hypothetical situation. Following them for 2 months. What is the likelihood that that person would die during that 2-month period, even if the vaccine had absolutely no side effects? Maybe it's a saline vaccine. Let's just say we pat you on the arm, okay? So what is the risk of someone dying who's 85 if we just pat them on the arm over the course of 2 months? Well, let's look at the data. The raw death rate is over 13,000 per 100,000. In other words, that equates to over 12% per year. And the reason I use 12% and not 13% is to make the math easy, because you divide 12% by 12 months, and that means it's over 1% of the population 85 and over in the US who's going to die every month. So follow anyone for 2 months in that age range, and you realize they have a 1 in 50 chance that they're going to die, even if you just patted them on the arm. If you give them a vaccine, same deal. If you give them a haircut, if they brush their teeth, all these things are independent of the fact that they're going to die. Now, that doesn't mean there couldn't be a vaccine that could kill people, okay? But all I'm saying is just to say, hey, we looked at a group of 87-year-olds in the US, and 1 in 70 of them died after they got the COVID vaccine. This killing people, it's killing off our most vulnerable aged people. That would be an inappropriate use of the VAERS data. It would be an inappropriate use of ultravigilance. So tallying up deaths makes no sense. By the way, if you're really interested in this, look at some of the deaths that have been tallied up. These are just incidental deaths. There's accidents on there. So you really think that getting a COVID vaccine is going to make you more prone to an accident? Well, maybe. But you can't say that it's connected until you do some more rigorous scientific study. Let me tell you 2 true stories that help illustrate what I'm talking about. These are 2 patients that I personally worked with. Of course, I'm going to change details so that we maintain their confidentiality, but let me walk you through these scenarios. First patient we'll call Bob. Bob is in his 40s. Generally healthy guy. He's a college athlete. I mean, he still looks quite fit. Yes, he's developed diabetes and high blood pressure, but he's a healthy guy. Bob gets the COVID-19 vaccine. He gets one of the messenger RNA vaccines that we've been talking about. 2 weeks later, he has a massive stroke. Half his body paralyzed. Was the vaccine involved? Hang in there. Let me tell you the other story. This time, I'm going to tell you about someone we'll call Sue. She's in her 20s, perfectly healthy. She gets one of these messenger RNA vaccines. 3 weeks after her second dose, she's not feeling all that well. She keeps feeling worse. She's into doctor and then to other doctors, and finally she's in the hospital. They diagnose her with an autoimmune condition called dermatomyositis, and she doesn't respond to treatment. Sue ends up dying. Perfectly healthy. Recently vaccinated for COVID-19. What do you think? Clear evidence of 2 conditions that were linked to those vaccinations? Well, before you jump to a conclusion, let me tell you, like I promised, I was changing some details to protect the identity of the patients, also to help us with the illustration, because neither of those 2 real-life patients receive the vaccine at all. You say, well, what's the point of the story? Listen carefully. Those are real stories, real people. They could have just as well gotten the COVID vaccine 2 or 3 weeks before their diagnoses. Bob could have gotten a COVID vaccine 2 weeks before his stroke. I don't think it would have changed what would have happened. He still had a stroke at a specific point in time. Real story, really paralyzed to this day on half his body. And Sue could well have gotten, just by chance, gotten the COVID vaccine a few weeks before she developed dermatomyositis. Again, vaccine had nothing to do with it in either of those stories because neither one had been vaccinated. Do you understand my point? Things happen. The older we get, the more likely we are to die. But as a physician, I can tell you, bad things happen out of the blue all the time. If you vaccinate enough people, you're going to have in vaccine databases, these adverse events databases, you're going to have things that may sound scary, but it does not mean it was connected to the vaccine. You have to look at large numbers of people, say, was there really any difference in the number of people who were diagnosed with dermatomyositis or who had a stroke and who got the vaccine compared to those who didn't? And what we're finding so far is there does not seem to be much compelling data that these vaccines are causing any serious side effects, okay? At least in the vast majority. I'm not going to exclude the possibility, of rare side effects in some people. And you say, that's reason enough. And I'll be honest with you. That's what made me hesitant about getting the vaccine. So hang in with me because I'm going to tell you what changed my mind, because I promised you I'd let you know I did get the first dose of the Pfizer vaccine. And then I started asking myself the question, well, I did well with that, didn't hurt me, no side effects. Should I get the second dose? I'll tell you that too in a few minutes. Let me share something that really drives this home. It was something that Dr. Eric Walsh, an MD and MPH, also holding a master's in public health degree, shared on a recent edition of my weekly show, American Indian and Alaska Native Living. If you're trying to hunt down that program, it aired the week of April 19th of 2021. Listen to Dr. Walsh.
Just because you survive this, which overwhelmingly like 99.5% of people are going to, there's another set of people who are going to survive it with some long-term consequences, because people are saying, wait, I don't know the long-term consequences of the vaccine. Our response is, listen, you also don't know the long-term consequences of getting COVID.
I thought Dr. Walsh was right on point, because this is what people are often not including in the equation. Eric made it even more practical when he shared the case of one of his patients, just a really chilling case. Listen to what he said.
I saw a patient just a couple weeks ago in her late 30s who 1 year after being, almost a year now after being diagnosed, still has significant medical problems, is seeing a cardiologist, a pulmonologist. She was a healthy person before that.
I'll be honest with you. I struggled as to whether or not I should get the COVID-19 vaccination. I'll just be honest with you. I didn't make that public when I was struggling with it. I was sharing with some of my colleagues. A lot of them had gotten it. I remember one of my friends who's also a physician, we were talking together and they said, boy, most of our colleagues have all gotten this vaccine. And we were saying, yeah, I think there's still some questions there. And really, I was walking through just what Dr. Walsh would later walk through on my radio show. Here's what made the difference for me. I started looking at data on what happens to people who get natural COVID-19 infection. I'm a healthy person. I'm not taking any regular medications. I have generally good health. I don't think I'm at very high risk. I try to be on a very healthy lifestyle. But I started to look at the data. In some data sets, individuals with COVID-19, even with asymptomatic infections, presumably very healthy people, right? They didn't even get sick noticeably. 1 in 5 of them with serious long-term complications. Now, by serious, I mean it didn't just put a spot on their forehead. By serious, I'm talking like losing the sense of taste or smell. Now, some of you say, well, that's not all that serious. Nobody dies from that. But I'll tell you, that really impacts your life if you can't taste or smell. And it can have life-threatening implications. may not smell a fire, something like that. Let me tell you, though, there's more to it. Some of those long-term side effects, even in people who had asymptomatic COVID-19, healthy people apparently, are long-term neuropsychological effects, long-term fatigue, long-term respiratory effects, just like Dr. Walsh was sharing. Healthy young people, now with lung disease, now with heart disease. That's what motivated me to get the first dose of the Pfizer messenger RNA vaccine. But I'll be honest with you, I'm a risk-averse person, okay? I don't want to expose myself to any risk. So if that's why you've been avoiding vaccination, I mean, I can understand. I'm just like you. I'm looking at myself. Hey, I got one shot. That's given me some protection. Yeah, I'm not fully protected necessarily, but, well, I'm generally healthy, got one shot. Shouldn't that be enough? You know what motivated me to get that second shot? I'm not saying it's the only thing, but it was listening to all these myths, some of which I think well-meaning people are sharing out there, but are discouraging people from getting these messenger RNA vaccines. Myth number 4, the vaccines are experimental. The vaccines are experimental. This is a myth. And the myth stems from a misunderstanding of what the emergency use authorization is for vaccines. You can just go to the FDA website. You can read all about it. It's not for releasing things that haven't been adequately tested. It's not something to turn out to the public things that are experimental. The experimental process has already been done. I'll talk about that in a minute. This emergency use authorization is a fast tracking. It's an expediting the normal bureaucracy of the FDA to get promising treatments out sooner when there's an imminent need to do so, whether it's a vaccine or whether it's a medication. You see, the experimentation, like I said, has already been done for these vaccines. When we test a vaccine, it goes through phase 1 trials, then phase 2 trials, then phase 3 trials. All of these have been completed. These vaccines are not experimental. Thousands of lives have been studied. Before these vaccines were released, they were found to be generally safe and effective, and that's why they were fast-tracked. They are not experimental. Now, in defense of those who are using this terminology, okay? Sure, you could look at any drug or therapy, any vaccination, if you're taking it for the first time or the second time or the third time or however many times you've been taking it, you can look at it as experimental on you. Experimental in the sense that you don't know what it's going to do to you. And I mean, you could always argue that. You could argue that with anything, no matter how well tested it is. And it's true. I'm not going to tell you with a straight face that there's absolutely no possibility for a side effect to anything. The safest drug, the safest vaccine. Even if COVID-19 messenger RNA vaccines, if they're compared years down the road with every other vaccine made, and they say these were the safest vaccines that ever were introduced, there's side effects, potential side effects. But that doesn't make it experimental in the medical sense of the word. Now, this is just my personal view as a public health professional. I've got my boards in preventive medicine as well as internal medicine. That doesn't make me any better than anyone else, but it just discloses to you how I think. I'm thinking prevention when I deal with patients. And if a patient walks into my office and says, well, I don't want anyone experimenting on me with these vaccines, believe me, I have a problem with someone saying that, especially if they're experimenting with other known drugs and toxins. That's right. Experimenting on their own bodies with things like tobacco. I mean, can I tell you unequivocally? Cigarette smoking, compelling evidence, it's much more dangerous than the COVID-19 vaccination. These messenger RNA vaccines I've been telling you about. You say, well, we haven't had them out that long. How could you know? Most vaccine side effects, serious ones, tend to occur relatively early. You say, but how do you know something bad's not going to happen down the road? You know, we're still learning about the side effects of tobacco smoke. You're experimenting on yourself if you think you can beat the data when it comes to tobacco smoking. So please don't say you don't want to experiment on yourself and take a couple of shots of a vaccine if you're smoking. 7,000 chemicals, more than 7,000 chemicals identified in tobacco smoke. If you're using alcohol, you're experimenting on yourself. Convincing data, multiple studies, increasing cancer risk. Well, what are you worried about? Long-term effects of the vaccine? Well, it might cause autoimmune disease, might cause cancer. Why are you experimenting with alcohol? Well, I'm just a social drinker. No, I'm talking social drinking. Compelling data, it's increasing your risk of a host of cancers. What about marijuana? The data on marijuana so far suggests it's worse for your blood vessels than tobacco smoke. It's hard on your lungs. You're experimenting with all these things. Red meat. Do you know there's research showing the more red meat you eat, the sooner you'll die? And are you experimenting with that? Well, yes, and listen, I'm 60 years old. The red meat hasn't hurt me yet, nor have the cigarettes or the beers. You're experimenting with yourself. If you want to use that term for experimentation, in the sense that taking something that may have questionable effects down the road. My point is simply this. In the medical sense of the word, these vaccines are not experimental. Let's look at myth number 5. And that's that the so-called Tuskegee experiment proves that we can't trust the mRNA vaccines. Now, I'll be the first one to admit, this is a sad chapter in American health history. African-American men not treated for syphilis for multiple decades in some cases, not being given life-saving, disease-treating antibiotics. I can understand why this would leave a bad taste in many people's mouths. But listen with me to Dr. Eric Walsh. Eric himself, African-American. What does he have to say?
Well, I'll say that there is historical reasons why people have some doubt in trusting the government and even the medical establishment.
He's not sugarcoating it either. He's not sugarcoating it. There's some bad things that have happened to minority populations, even in the medical arena. By the way, I wish I could tell you this wasn't true, but I know even to this day, there are people because of their race, because of their gender, because of their socioeconomic status, are not treated like other people. And that's sad. Here's the real concern. What was the problem with the Tuskegee experiment? The problem was they weren't treating African-American men. They weren't giving them the treatment that they deserve like anybody else. Dr. Walsh picks up on the irony of this history. Listen to what he said.
African Americans and in some parts of the country, indigenous populations also have higher rates of infection and higher death rates, higher complication rates from COVID. And then to see now, the weirdest of all ironies is now that there's a vaccine that might protect them, to believe that somehow the vaccine is a problem. Biggest fear is that African Americans would have suffered all this time, not want to go and get the vaccine. And when this pandemic is almost like over, the virus is still wreaking havoc in Black, African American, and other minority populations across the United States, and not receiving the kind of media attention it's getting now.
Do you see Dr. Walsh's point? I mean, if you're worried about the Tuskegee experiment, that's when minority people weren't getting access to the treatments that other people were. When I got my 2 Pfizer mRNA vaccines, do you know where I was getting them? I was getting them a big hospital clinic, vaccination clinic. They were doing a great job. Everybody was being treated there. They didn't have different lines for different races, different buildings. It wasn't based on your gender or your age. Everybody was getting the same treatment. And this is why it's an irony for people to be saying, well, I don't trust the government. This isn't the government. This is Pfizer. This is Moderna. Yes, the government gave some money to fast track these vaccines. Government probably gave you some money too in the form of a stimulus check. If you cash that, you did nothing different than what these vaccine companies did. They took government money to help during the time of the pandemic. So I've tried to look with you at 5 COVID vaccine myths in this video. And I want to express them positively. Let's focus on the positive. First, we learned that these vaccines clearly are still necessary. COVID-19 is still claiming lives, causing hospitalizations in younger and younger people, relatively speaking, and causing long-term complications. Second of all, the research shows these messenger RNA vaccines are indeed effective. The vast majority of people who get these vaccines protected from serious illness, from death, protected from transmitting the virus as well. Number 3, people are not dying in droves from these vaccinations. If anything, these vaccines are emerging as extremely safe. And although, of course, they are new vaccinations, we don't know the long-term side effects. I know that that's what some of you are grasping on, but remember, we don't know the long-term side effects of COVID-19 either, and we're seeing it's not a level playing field. The evidence suggests that the long-term effects from COVID-19 are far worse than the long-term side effects from the vaccination. Number 4, these vaccines are not experimental. They've been fully researched in phase 1, phase 2, and phase 3 trials. These messenger RNA vaccines have been fully tested. You're not being experimented on if you get the vaccine. And number 5, although there are some sad chapters in U.S. public health and U.S. medical practice history, the Tuskegee experiment is just the opposite of what we're talking about here. If you would benefit from this vaccine, if you have a question, get this vaccine. I think that's the reasonable thing to do. Well, hopefully that gives you some perspective on a topic that I think still is cutting edge. And if you're hearing from folks that are sharing with you videos or other information that's grabbing onto these same myths, I hope you'll share this video with them. Let's make really sound decisions looking at the big picture when it comes to all of these things. I know that's the same rhetoric that some of the folks are using to promote the myths that I've tried to address in this program. But really, I think for most of us, the messenger RNA COVID-19 vaccines offer us more benefits than risks. Please take that into consideration when it comes to caring for your own health. And as it relates to caring for the health of others, well, that's another topic, maybe next time. Until then, I'm Dr. David DeRose, wishing you the very best of health.